Welcome back to episode 3. And this topic is, what is stigma in public health? So, stigma is when people feel judged, ashamed, or afraid to talk about certain health issues. This can be related to mental health, sexual health, or even just asking for help. The problem is when people feel judged, they stay silent. And silence leads to misinformation, lack of education, and people often not getting the help that they need. That is why our mission is breaking stigma through real talk, because conversations create change. Stigma is also can be derived from people's circumstances, how they were raised, what they were taught, and also the access that they have to their care, to beliefs, misbeliefs, to judgment. That's why it's important, as what we stated in the last couple episodes, and talking about misinformation and why education and prevention is important in public health. Stigma can also be seen in substance use or chronic illnesses, as well as HIV, mental health issues, sexual health issues, depression, anxiety, fear. Stigma again leads to silence and shame, which prevents people from seeking help, which also can increase our numbers and increase our illnesses and outbreak numbers in our data. Stigma impacts public health because misinformation spreads when people do not feel safe about asking questions. This is how we get the typical, "Hey Siri," or "Hey Google, I'm coughing today. And I've been coughing for 5 minutes. What does this mean?" Or taking the narrative, what they already believe about their health, again, by what somebody has educated them in their family, or what their mom and their dad educated them about what they knew about health. The thing is about information, it's passed down from generation and generation and generations, and that is how we have a high number and high increase of health issue health issues in a current generation. Lack of education means communities do not get the resources that they need. People avoid care or treatment, making illnesses worse or even harder to contain. Stigma is dangerous because it prevents communities from protecting themselves. Real life Real life examples includes a person avoids mental health services because they feel judged. Families hide illnesses out of fear of discrimination. Communities ignore educational campaigns because of shame. Addressing stigma is very vital for creating healthy, informed communities. Now, let's talk about some of these examples for a little bit. Discrimination. So, this can look as from race, cultural, social status, financial status, your education level. All of these things can prevent families or individuals from seeking care. And our job as educators and public health experts is to educate these communities about the truth. But the thing is if they don't cannot see themselves in their own clinic, or themselves inside of their own community, or feel welcome when talking about these issues, then it's a problem. The thing is, we need to start normalizing public health issues, not the things that we care about, or not the things that's high priority. Trust me, there are certain health issues that are high priority, but it's also dependent on where you live, where you stay, your culture, what's important to you, what is important to your beliefs. All of these factors are very vital components with stigma. If your religion says, well, you can't eat pork and all those things, and our religion said another religion says you can, that is discrimination. Because if you go to the hospital or the doctors, your doctor might be a believer of the person who's not, you cannot eat pork. So if I'm a pork eater and I go to the doctor, I might feel discriminated because that doctor or that person might say, oh well, if you should stop eating pork, you wouldn't have that problem. But there are ways that we say and educate certain issues in public health. Ignoring educational campaigns. Some of these, this probably is an issue that some of us as healthcare professionals or clinics have. We're not making sure it's diverse and people are able to see themselves. Making sure that we have people that are interpreters inside of the clinics or in the workforce, educating people in the field, not also behind a wall, not behind the glass, but out in the community, educating people about vital information that is very important to them, but important to the world and our community. Feeling judged. We should not want a person to feel judged when we're educating them or talking to them. It should be a real conversation, a dialogue. We don't have to sound scripted, we do not have to sound rehearsed. This is real conversation. Hey, how are you doing today? Or hey, how do you feel about such and such? What do you think about this topic? And that is how we can see where stigma is lying, where barriers are laid in the road, and how we can debunk stigma and address barriers at sight. So we want to continue to talk about these things and continue to address the things that are very, very crucial and fundamental to public health and to stigma. Addressing stigma again, we do not want anyone to feel judged. We want to be very, very welcoming to people when we're talking about public health or issues, illnesses, diseases, outbreaks, not pointing the finger at this community, not pointing the finger at this nation, or not pointing the fingers at nobody. We're addressing the situation head on because not only does it affect this community, it affects everyone, especially when it comes to mental health, social income, social statuses. All of these things are already an issue when we're talking about healthcare. So let's keep it very welcoming. Let's keep it very surface level. If a person want to dive deeper, we can have that conversation with them. If you have time to have that conversation with them, if you do not know, as we stated in the previous video, we will point them into direction of people that do know, research it ourselves, and and engage in the conversation. We want to be very, very engaging when we're talking and having these conversations. This is not something behind a wall. You should want people to be able to feel that you can connect them and meet them where they are. And this is very, very, very important on meeting people where they are, because that right there can debunk and address and erase so much stigma when you meet a person's eye to eye level. Understanding them as a person, not a number, not a stats, not a um not an illness, not, oh, this is part of your community, oh, you're just living in the status quo, oh, this is because you only make this amount of money, this is only because you have X amount of people that you're connected to, or this is because that you didn't graduate from such and such. We want to meet, whether it's a dog, we want to get to their level and meet them where they are. Whether it's a 3-year-old kid that is concerned about why they're sneezing for the last 5 days, we want to meet them to their level. When it comes to educating hand washing, this is stuff that we can meet at their level, and we just have to take action. And tomorrow episode, we will discuss a little bit more, why does this podcast exist, How does campaign and conversation spark real change in public health? So we're going to take a little break from talking about public health, but we're going to talk about the real foundation of this podcast. See you tomorrow.